Great, thank you. Welcome today. My name is Dr. Constance Scharff. I come to you from Cliffside, Malibu. Cliffside, Malibu is an elite addiction treatment center in Malibu, California. I am the Senior Addiction Research Fellow and the Director of Addiction Research. What I do is primarily analyze the research that comes out of a variety of fields: neuroscience, psychology, medicine, complementary medicine, and other areas, to look at what might help us with regard to addiction and addiction recovery, because most of the addiction research that's being done does not have very good clinical application, if any clinical application at all. Most of it's genetics or pharmaceutical, which are two things that we are not working on at Cliffside Malibu. So what we want to do is get people into recovery. I have a tremendous passion for the work that I do. I absolutely love my job. And the reason for that is that I am sober myself. I have been in recovery for almost 16 years. And when I was getting sober, there was very little in the way of recovery resources. You had 12-step programs and you had nothing. And those were basically your choices. And you know, if you went to the doctor and the doctor said you were an alcoholic, they sent you to a 12-step program where they tell you to pray and to meditate and to hope for the best and to volunteer your way out of it. And that really isn't a very good model for most people. And I found myself in sobriety very miserable. I was able to get sober, but I thought, this isn't the life that I was meant to live. And I was volunteering with men and women from the Veterans Administration, the place for returning soldiers in the United States. And they were coming back from the wars in Iraq and Afghanistan, and they were not recovering. They were relapsing at almost 100%, and many of them were committing suicide. And I thought, there has to be something better out there with regard to addiction treatment. So I left a very promising career in nonprofit management, and I went to grad school, and now this is what I do full-time, as I look for that better way in terms of addiction treatment and addiction recovery. The scope of the addiction problem in the United States is tremendous, and it is similar in most countries around the world. Some general statistics from America. It is estimated that 10% of Americans suffer from addiction, but only 13% of those addicts will ever seek addiction treatment. To give this a little bit of context, I looked up the Greek population, which is around 11 million. The US population is around 318 million. So the United States has roughly has addicts roughly equivalent to 3 times the entire Greek population. It's a pretty big problem. Alcohol is the most widely abused drug, but painkillers are being used in epidemic proportions. Accidental overdose kills 1 person in the US every 19 minutes. Accidental overdose, now out of prescription medications primarily, now outpaces heroin and cocaine overdoses for deaths combined. Heroin is making its way into the suburbs because it is cheaper and easier to access than prescription opioid medications. Though they have helped millions to get sober, 12-step programs have a success rate estimated at 8 to 13%, though some say far less, in the range of 5 to 10%. So what we're looking at in layman's terms is that if you send 100 alcoholics to Alcoholics Anonymous meetings, at the end of 1 year, you will hope that 10 of them are still sober. And we think it's probably more like 5. So although we do have millions of people getting sober through that route, it is not tremendously effective. There has been no rigorous exploration of AA for its efficacy because of the nature of the program itself, but it continues to be the treatment of choice in the United States. So we have a medical treatment of choice that has no proven efficacy. It's quite a conundrum. 1 year post-treatment, less than 13% of people who went to a residential treatment center will still be sober. Most treatment centers do not use evidence-based treatment protocols, nor do they divulge their success rates. Can you imagine going to a hospital that didn't tell you how many of its patients died after receiving their treatment and how many of their patients lived or had a better life afterwards? This is absolutely an unacceptable situation. and we want you to know that there is a better way. At Cliffside Malibu, we use the latest science to redefine what addiction is and how it is treated. We have a constantly evolving treatment protocol based on changes in the evidence base. So when new science comes out, we change our treatment protocol. New understandings from neuroscience help us to, in effect, rewire the brain from a compulsion toward addiction to an impulse toward recovery. We use breakthroughs in psychology and complementary medicine to develop a protocol that allows for this brain rewiring. And our success rate is such: 1 year post-treatment for those who complete our treatment or do not, people who come in for 1 or 2 days or people who stay the whole course of treatment, 7 out of 10 will remain sober at least to 1 year. That's as far as we track. For those who complete all 3 levels of care with us, we have a 90% success, over a 90% success rate for people who are 1 year post-treatment. If you compare that to Alcoholics Anonymous, on its own, it's a tremendous difference. The book that was in the last slide is available here if you want one. They're a book that outlines this treatment protocol that I'll discuss in detail. They're available over here, and they are, take one for free. They're our gift to you. I'd like to talk a little bit about neuroscience. What we're learning about addiction and addiction recovery is that addiction is not the genetic disease that we previously thought it was. Addiction has been defined basically in 3 ways throughout history. First, it was a moral failing, right? The Puritans put you in the stocks because there was something wrong with you. And if you really loved your wife, you'd stop drinking, right? That's what we used to say about alcoholism and drug addiction. Then it was redefined as a disease, right? But it doesn't, and I'll talk about this more in detail, it doesn't meet the criteria for being a disease. And what we're now looking at addiction as, and there's some wonderful studies that are coming from neuroscientists.